You have heard about learning disability before, I bet. But you might not understand the fact that I, for one, I also have a condition because I struggle to pronounce some words. Learning disability can be defined as a neurological or a mental process problem, which means people who have this challenge have problem processing information. It could impact their learning, it could impact their personal life. However, having a learning disability is not a major problem because it could be mild, moderate, or severe. But most times, there could be an educational intervention or a medical intervention. Commonly, there are three types of learning disability, but people always call learning disability what it is not. For example, attention deficit hyperactivity deficiency (ADHD) is not a learning disability. Rather, it is a behavioral problem that has learning disability present in it. Going forward, dyslexia is the number one thing I'm going to talk about. Dyslexia is a medical term, and this is a problem that has to do with reading, speech, and word processing. Therefore, children with this condition, they are going to have problem in reading, difficulty in remembering, and even pronouncing some words. The next one is dyscalculia. Dyscalculia has to do with problem peculiar to mathematics. Children could have problem with calculation, figures, memorizing, and counting. Children with this condition might suffer to understand mathematics. They might have they don't have problems solving problems, mathematical problem, and they could even have problem remembering dates, months, weeks, all of these things that have to do with figures. Then the next one is dysgraphia. When you talk about dysgraphia, it is peculiar. It is a medical thing that means that children struggle with writing. So their fine motor skills could have been impacted. Children with this condition, they have problem with handwriting and they have problem with uppercase and lowercase. They might not be able to write a complete word. They are slow in writing and they have unimaginable or a problematic approach of holding the pen. They also have problem thinking, and when it comes to writing, it stresses them so much. Now, these are the three common ones: dyslexia, dyscalculia, and dysgraphia. However, according to Brain and Core, this organization felt that there are others. I'm going to mention a few of them. The next one is language processing disorder. This has to do with difficulty remembering words or appreciating the difference between alphabet, letters, and sound. So children would not be able to describe words appropriately. They might not be able to give a name to objects because they have problems remembering the name of things. The next one is going to be that they cannot understand stories. And when you're trying to play with them with jokes, they could actually misunderstand it because they have a problem to process the language you use. The next one is going to be audio processing disorder. This has to do with problem of sound and words too. And children in this category speak too fast, and I'm not sure I'm like that, and they have problem with oral presentation, and when you are making noise, they cannot do anything. The next one is non-verbal learning disorder. These children are children who does not understand non-verbal communication. For us, culturally, I'm from Nigeria, our parents could talk to us using their eyes, using their body language, and we could understand. But children that are unable to understand this, that is also a learning disability. And finally, visual motor deficit disorder. This has to do with problem that has to do with eye-hand coordination. Children cannot be able to concentrate when they have to make facial expression. They also have problem to use their hand that could be holding things, carrying things, or writing things. Learning disability is not a major problem. Your child could be supported. You could also support your children, but know that environment could be a factor. Heredity could be a factor. If you have a concern, the first thing to do is observe your child, talk to the teacher. Then if it's going to be a kind of a situation that they need extra support, then you can see a child psychologist. But then it is not a major problem because it is normal. For example, you don't know mathematics, your child might not even know mathematics. Why your child could also struggle to read because you are not helping them appropriately. You must have learned one or two things. Next week I'm going to talk to you about autism. Take care and have a wonderful day. Bye.